Hi, welcome back to another episode of ASCEND TV. I'm your host, Dr. Leslie Cadet, a board-certified occupational medicine physician and the founder of ASCEND Occupational Medicine Consulting, where we help self-insured employers get a handle on their work comp programs. Today, we're going to be talking about another case of low back pain gone crazy. In this story that I'm about to tell you, true story from a client, the patient is middle-aged and he works in a printing shop. And a part of his job is to push, pull printers that can weigh anywhere from 25 to 50 pounds. And one day, about 4 years ago, he strained his lower back. Now, at Ascend, we do a lot of work with what is the expected timeline of recovery for a specific injury. And in occupational medicine, workers' compensation, the majority of the cases are musculoskeletal in nature. Okay, so for those types of injuries, there's a very defined time course. And in the case of a simple low back strain, that typically can fully recover within 2 weeks. Sometimes it can take as much as 8 weeks. Well, in this instance, this patient has been treating for 4 years by the time we got a hold to the case. And so we're going through the medical records, and what we see is that the patient has not only received Tylenol, ibuprofen, physical therapy, chiropractic adjustments, they've also received some imaging. Now, they got an MRI of their back, which showed degenerative changes. And there's a fancy Greek and Latin name for that, but you, as the employer, don't need to be concerned with our Latin speak, right? They basically had wear and tear on the spine that is a result of their age. Now, someone might try to argue that pushing and pulling printers is a very manual job. I would argue that for a grown man, a 25 to 50 pound printer really does not fall in the category of laborious work that's really causing damage to the spine. It would be different if we were talking about a construction worker. It would be different if we were talking about a football player. It would be different if we were talking about a firefighter, okay? But for somebody who's working for all intensive purposes an indoor job where they're moving smaller printers, not enough forces on the spine, in my medical opinion, to be considered hard labor, all right? So as a result of the doctors seeing this wear and tear on the spine and not completely understanding how workers' compensation works, they proceeded to treat him with facet blocks. And facet blocks are where you go in to the joint spaces of the spine and you try to numb them up, right? So that the patient doesn't feel pain. I'm not a huge fan of facet blocks, especially in the work comp ecosystem. I've never seen where the patient had lasting relief that brought about meaningful resolution of the claim. I have only seen this drag out the length of the recovery period, drag out the length of the claim. So the patient got not one, not two, but three facet blocks and still was complaining of severe pain. All right. Then they wanted to go in and do another procedure called an ablation where you burn the nerves so that the theory is that they won't feel any pain. The problem with that is sometimes those nerve endings grow back, and so they still have pain. Well, utilization review, and I'm not a big UR fan, but in this case I am. They said, hey, that procedure is not indicated and we're going to deny. We're not going to pay for that, which I think was appropriate. So we're at the end of 4 years. The patient is still working at their job, and it appears that none of the doctors, whether that's the primary treating provider or the neurosurgeon, no one is talking about making this worker at maximum medical improvement, which means we've done as much as we could do with our Western medicine and it's time to close this case. What was interesting to us is that the original injury was a strain. The original injury was not degenerative spine disease, but somewhere along the course of the claim, we got sidetracked and we started treating non-industrial arthritis as opposed to keeping our eye on the ball, which was industrial strain. So, for all intensive purposes, when the employee had gone through the Tylenol, gone through the naproxen, gone through the physical therapy, right? That is all that we needed to do to treat a sprain. A conversation should have been had with the employee from the doctors that said, hey, we did what we know to do for strain. We're sorry that you're still continuing to have pain. We believe it is because of your underlying non-industrial arthritis. And so while our portion is complete, we've treated your strain, we're now going to transition your care to your primary care doctor so that they can continue treatment for your non-industrial arthritis. That never happened at the 8-week mark, which is where we expect lumbar strain to have fully resolved. So the case was just allowed to go on for 4 years. So now here we are 4 years later. The client has paid out $32,000 on the claim, and we need the treating provider to have that type of conversation with the employee so we can bring the claim to closure. All right. So that is the type of work that we do at Ascend is where we reach out to the primary treating provider, we reach out to the neurosurgeon, and we provide this nuance that's unique to workers' compensation because the neurosurgeon and the primary treating provider, they didn't do occupational medicine residency. So they don't understand the dynamic that's at play here, where we have very distinct lanes between what's industrial and what's non-industrial. And so after we educate the providers and get them on the same page, we're extremely hopeful that they will go ahead, make the patient at MMI, and allow him to transition care to his primary care provider, which is his regular doctor, where his primary insurance would be covering the remainder of his arthritic care. If you would like to hear more information like this, we are having a webinar this coming Wednesday, October 15th at 12 p.m. Pacific Standard Time. And we're going to be talking about the 4 claims that nobody wants and how to spot them early. So there's a whole strategy around workers' compensation to where your claims don't need to go out for 4 years. You don't need to pay $32,000 for a low back strain. So we're going to be talking about those sorts of things in the webinar. I would love to see you there. The registration link is in the description box. If you have not liked the video, subscribe to the channel so that you get new content every month when we release a video. We'd love for you to go ahead and click the subscribe button. And until next time, peace.